Now, honorable colleagues, the, the, the Honorable Arion came to me on that same matter. I told him, I said, number one, I don't deal in procurements. That's the work of the clerk and technical team. But number two, I told him, I will get for him information whereby I would get the contracts. Next I saw is a video of the Honorable Arion circulating, saying how Parliament has been taken over, how Ugandans must come and reclaim Parliament, how food is being sold at 45. Now, Honorable, I checked with the clerk. Number one, the contract of the previous contractor expired. And Parliament ran an advert, and several companies, please, Honorable, we have a technical team. We don't, I can tell you members of Parliament, I think we are overstepping our mandate. I think so. I think we are even about to go to ask how you clean, how you do what. I think really it's reaching a level where some of us, we are thinking it's beyond the fight against corruption and all that to something really beyond. But for the record, and I want to be quoted, for the record, the contract buffet for members of Parliament, a plate together with the drink has been at 13,983. This is a contract that had been running for many years. For staff, it has been at 10,000. And I have the documents here. And in fact, I had come with them because I thought I would meet Honorable Arion earlier on. I give him the documents. But he has now provoked it early. Now, a buffet for a member of Parliament now is at 21,000. Yes, I'm having the official documents of Parliament, a contract. And after over 10 years, and a buffet for staff is at 13,000, an increment of 3,000, which came out of a procurement process. Now, for a member to go out and address the public on the food we supply members of Parliament that government pays for, to say someone is doing it at 45,000, honorable colleagues, I request you, okay? If a member had come to me and said, right, honorable, this information I asked, please avail it to me, I would have met him and given. That's why I came with them. I wanted to give them to him from here. So, honorable colleagues, please, I will not allow a discussion of your food on the floor of Parliament. That one, we will get away of discussing it, but not here. To discuss food, how much we pay for food to members of Parliament, I think we are going beyond. Honorable Minister for Health.
Food is definitely important, but I humbly request that you listen to me also. Right Honorable Speaker, honorable members, allow me to appreciate you, Right Honorable Speaker, for granting me this opportunity to provide information to this august House about the status of monkeypox, and I request that you allow me from now on to refer to it as mpox, as it is called. Right Honorable Speaker and honorable members, mpox is in the same family of viruses like smallpox that was eradicated over 40 years ago. And it is believed that it originates from wild animals like monkeys and squirrels. Since the beginning of the year, more than 17,000 mpox cases and more than 500 deaths have been reported in 13 countries in Africa, according to the African Centers for Disease Control and Prevention. The highest number of cases, more than 14,000, is in the DRC, which reported 96% of confirmed cases this month. Other East African countries that have reported mpox transmission are Burundi, Kenya, and Rwanda, with Burundi having secondary transmission. Mpox transmission to humans is by contact with the infected animals. Among humans, it spreads by direct contact with an infected person, sexual transmission, with high transmission among commercial sex workers, men who have sex with men, and truck drivers. It also spreads from contaminated surfaces, crowded settings, especially schools and prisons. The schools and prisons increase risk of fast spread if there is a confirmed case because of congestion. Treatment: mpox is a self-limiting disease presenting with pustules. I'm sure many of you have seen chicken pox. So those are the pustules, or you can call it small boils on the skin. Often it is also associated with high-grade fever, swelling of the lymph nodes, headache, and general body weakness. Those small boils can be anywhere on the skin or mucosal surfaces like the eyes, mouth, the genitals, or the anal area. Treatment is symptomatic depending on the complaint, as there is no specific treatment for the virus. Right Honorable Speaker, regarding the vaccine for mpox, there are 2 vaccines under consideration for deployment. There is one which is called MBABN. It is a 2-dose regimen currently with the US FDA, and it is approved for adults, used in adults. 2 is what we call LC16, produced in Japan with local regulatory approval in Japan, and it is recommended for both adults and children. Both vaccines are pending emergency use licensure by WHO. Right Honorable Speaker, regarding disease progression and outcomes, despite the self-limiting nature of mpox, in a number of cases, the disease can be fatal and may cause death, especially in children under 15 years, pregnant women, and individuals with weak immunity, like persons living with HIV/AIDS who are not suppressed. In addition, the public health implications can be dire for the communities and individuals affected. If robust interventions are not made, infection may spread, and a huge patient case number can overwhelm the health system, as we have seen elsewhere. Facial and body lesions among immunocompromised individuals can be disfiguring, where they severely affect the quality of life of individuals in the long term. In some cases, patients have been reported to have suffered eye complications and permanent blindness. Right Honorable Speaker and honorable members, mpox was previously endemic in Central Africa, especially DRC and West Africa, but in 2020, the disease re-emerged globally. In 2023, mpox had a huge rebound in DRC, including rapid expansion in many other African countries. In the case of Uganda, Right Honorable Speaker, on the 24th of July 2024, the Uganda Virus Research Institute confirmed 2 cases of mpox from 6 samples received from Bwera Hospital, Kasese District, from suspected cases. The 2 cases were a 37-year-old female, a market vendor, who also operates a hair salon at Mpondwe border point. She's married to a Congolese man. The second, a 22-year-old Congolese pregnant woman from Bunyuisa 2 village, Bwera sub-county, who was seeking antenatal care in Bwera Hospital. The 2 individuals were admitted and treated in Bwera Hospital and have since recovered and have been discharged with no complications. This is the first time mpox has been confirmed in Uganda. Since then, no new cases linked to the 2 cases have been confirmed in Kasese district or in Uganda. To date, a total of 42 samples have been collected from suspected cases, sent to UVRI for testing, and all have tested negative by PCR. Genetic analysis of the virus from the confirmed cases shows it is linked to the mpox of DRC, and we have its scientific classification, which I have included in your documents. It is MPXV clade 1B, which is linked to the DRC outbreak. Right, Honorable Speaker, it is important to note that mpox transmission in eastern DRC is expanding rapidly, with a new epicenter in North Kivu that is adjacent to Uganda. This happens amidst our regular cross-border human interactions between our 2 countries for trade, culture, and social reasons. This means the risk of importation into Uganda remains high, given the long incubation period of 7 to 14 days. There are 17 districts in Uganda that share a border with DRC, with regular movement of people, and 17 gazetted points of entry, and many undesignated land and water crossing points along Lake Albert and Lake George. In the past 2 years, there has been an influx of Congolese refugees into Uganda. For example, 23,821 refugees in 2023 and 18,423 refugees by July 2024. Furthermore, our troops are currently deployed and pursuing insurgents in eastern DRC, and they are also at risk. Long-distance truck drivers plying the region in the interconnected routes and resting areas within the East African area are among the most at risk and could act as a quick way of transmitting the virus. Right, Honorable Speaker, honorable members, allow me to inform this August House that yesterday, 14th August 2024, the World Health Organization declared monkeypox outbreak as a public health emergency of international concern. This follows the same declaration by the African CDC as a public health emergency of continental security on the 13th of August 2024. The 2 declarations call for concerted global and continental investment to reduce mortality and to maintain stable global trade and economy, and to avoid stretching health systems as seen in the DRC and Burundi. Right, Honorable Speaker and honorable members, regarding our intervention since we identified the 2 cases, when mpox re-emerged in the DRC, the Ministry of Health undertook a risk assessment in anticipation of potential importation of cases. A number of immediate steps have been taken to protect the population. Following the assessment, 23 districts were classified as high-risk districts, and these were the 17 districts bordering the DRC, 5 districts hosting refugees from DRC, and Kampala because of its highly mobile population due to trade and other reasons. This guided the development of a 1-year mpox preparedness and response plan. The plan caters for coordination of all mpox-related activities, including risk communication for prevention, surveillance for case identification and detection, laboratory investigation, management for confirmed cases, vaccination and research. Right Honorable Speaker and Honorable Members, in regards to the way forward, an emergency response mechanism, that is the incident management system, consistent to what we used to respond to COVID-19 pandemic and the 2022 Ebola epidemic outbreak, has been activated at the Ministry of Health and in Kasese district. The ministry has since reached out to the US government in Uganda and the World Health Organization for vaccines so that we can prioritize the high-risk groups. Those are the health workers, their contacts, and other frontline workers, but also including the vulnerable ones that I previously highlighted. We are working with WHO to enhance cross-border collaboration among countries in the region for real-time information sharing and cross-border surveillance. In conclusion, Right Honorable Speaker and Honorable Members, I wish to appeal to this august House to supplement the Ministry of Health efforts by amplifying the mpox prevention messages within your respective constituencies. And the message that we want you to carry forward is that we need to avoid physical contact with anyone who has signs and symptoms of mpox, as I mentioned above. Remember, the pustules resemble those of chickenpox. People should avoid sharing clothes, beddings, and other personal items with infected persons. Wash hands with soap and water, or use an alcohol-based sanitizer after contact with a suspected case of mpox. Contacts and frontline workers should be encouraged to take vaccination when it is available. And lastly, on that issue, suspected cases should be reported to the nearest health facility for assistance, or alternatively, call our toll-free line. As I conclude, Right Honorable Speaker, allow me to register my appreciation and that of the entire ministry to this august House for your continued support to the health sector whenever need arises. I beg to submit.